So that's basically a nice summary here. And I'm going to hand it over to Dr. McFalda. I know she's having some technical difficulties, so her speakers aren't working, but her microphone is working. So I'm going to kind of let her talk for a couple minutes. If you guys have any questions, Carrie and Wendy and I can all basically answer your questions via the chat while she's talking. She's going to talk about some of the things that she does to motivate and encourage her staff, which I know is a great staff and they really work together as a team very well. Uh, and so, with all ado, I'm going to turn off my speaker and I'm going to let Dr. McFalda take it. There you go, Wendy.
Can everybody hear me? Or can anybody hear me? All right. Okay, great. I'm actually in a different position. I think most of you guys work for Intuit or are QuickBooks. I'm actually a dermatologist in Clarkston. I started a private practice about 4 years ago, and I now have about 15 employees. We didn't always work together as a team, and it took me a lot of learning from what Stacy covered. I kept sitting and nodding my head because it had a lot of truth that rang true to me. I found early on that you can only motivate people so much with money. It works for a short period of time, but it doesn't seem to last. And so we really started working on team building and building a kind of environment that everybody wants to be at. And it's important to not only motivate people as individuals, but really to motivate them to work together as a team. Especially in healthcare, you need people working collaboratively to give a good patient outcome, and for the patient to feel comfortable that they don't have to choose one person when they come into the office, that they can be seen by anybody and get good care. So it started for us with starting our day out correctly. We meet for 15 minutes before the first patient is scheduled. That's the time that we do announcements. We troubleshoot any potential problems for the day. If anybody has to leave early for any reason, that we're all aware of it. Is it back? I don't know what happened, but it should be back on. Okay. Along those same lines, on Friday, we got them at an educator store. They're little stars, and they're not really construction paper, but we keep a stack of them kind of in a neutral area in the office with pens, and people can fill them out for their coworkers, just to kind of thank them. If they've had they've done anything extraordinary, to recognize them for their achievements, and we read those out loud at the morning lineup on Fridays. So it's a good way for people to appreciate the other people that they work with. The other thing that we do is set quarterly goals for sales or procedures in the office. And one of the things that we do is involve the entire office. They get the financials for the year before, and they are actively taking part in setting the quarterly goal. Once they've set the quarterly goal, and once we've agreed upon it as an office, then we kind of do little motivational things during the 3-month quarter to help them achieve it, whether it be advertising or doing more education around it. But then once we meet the goal, everybody gets an individual reward, usually a cash bonus. We have a standing agreement that at the end of the year, if they've managed to achieve all 4 quarterly goals, the office will take a 3-day cruise. That hasn't been met yet, but we've come awfully close. Also, we do quarterly workshops in the office. It's usually a Friday. The staff are paid like they were at work, and usually we bring in somebody who can work on communication skills, diffusing a difficult patient. I think this in December we're going to do something with goal setting, and so it's stuff that I take that time to help provide somebody who can help the staff with not only skills that they can use in the office and working with patients, but also with each other, and skills that they can take outside of the office. Along that same line, we do a once yearly weekend retreat where we work on the same things. So, really, we've been trying to come together more cohesively as a unit, and when you do that, you really do realize, the supervisor that you can identify individual strengths and use those, really kind of use those times to get to know your staff a lot better. And then when their individual strengths come out, reward them and try and encourage those things. And since I've been able to kind of incorporate all of these things into the office, we've had much less turnover. And okay. We've had much less turnover and have been able to maintain our staff pretty issue-free for about the last year and a half. So with that, I guess, unless there's any questions, if people can text them into the chat, I can answer them. Otherwise, I will turn it back over to Stacy. Thanks.
Great. And like I was typing in, can everybody hear me? Okay. Like I'm there once a week and I've seen what she's done and I've seen it, I've seen the evolution of it over the last year or so, and it works. I mean, it really truly works. The star system, they're literally little stars that she gets and they pass them out. I've been in there where some of the staff has helped me. I've even given Dr. McFalda a star because she helped me out while I was there. Working on her books. It's a really simple, nice system, and I helped them kind of get the quarterly goals together. And oh, there's a question from Lily. I'll let Wendy go ahead and answer that.
I haven't had anybody get competitive with the star system yet. Can you guys hear me? I'm sorry. Actually, it turns out to be more motivational. And if somebody isn't getting a lot of stars, then usually they know it's because they have to step up their own participation in the group, that they're really lacking in some areas. So sometimes it can be motivational when somebody isn't getting stars, but we haven't seen it get competitive yet.
If anybody else has any questions, go ahead. But if